Hello, everyone. Welcome to Stan&Chelle show. Do you know anything about surgical tech, or what does a surgical tech do? Today we have a special guest with us. Her name is Shalisa Thelisma. Hello, Miss Shalisa. How are you doing today?
I'm good. Thank you for having me.
Thank you for being part of the show. Without further ado, my first question is, what does a surgical tech do?
Well, a surgical tech does several different things. The first thing we do is we make sure that we have all of the supplies and the instrumentation that's needed for surgery. Our second responsibility is once that procedure starts is to assist the surgeon throughout that procedure, making sure he or she continuously has everything they need in order to do that surgery as successfully as possible. And we are also considered their second set of hands. So basically, whatever they can't do on that procedure, we are there to help them get through it. So if they need help cutting the suture, we'll cut it. If they need us to move an organ out the way, we'll move it. If we need to suction up the blood or any bodily fluids, we do that. Like I said, we are there to make the process, the surgery, easier for the surgeon to do. The third thing that we do is once the procedure is over, we will take those same instrumentation and materials and make sure they are sent off to decontam to make sure that they are cleaned and sterilized properly for the next procedure. And we make sure the room is clean, i.e. mopping the floors, wiping down all the tables, the OR bed, the lights, etc. And then we get ready for our next procedure.
Why did you decide to become a surgical tech?
I didn't choose to be a surgical tech. I was more or less led to it by God. I was going through a really tough time. I had lost someone that was very, very, very close to me, and I was going through the grieving process. And I knew that God could, still wanted me to do something with my life. So I asked him what, and he basically told me to go back to school. And when I applied for school, I did not know what I was going to be majoring in. And one day I went on the school's website and I was reading about all of the different majors, and I came across surgical tech. And I was like, that sounds like something that I could do. And then once I got into the school, I applied for the program. Once I got into the program, I was like, this is it.
What is the process like to become a surgical tech?
So the process, it's a 2-year process. You will receive your associate's degree at the end of the process if you so choose to. There's also the option for you to get your diploma, but a lot of people go for their associate's degree, which is what I chose. So most universities or colleges in general, you have your 1 year of prerequisites, which is your math, your sciences, your anatomy and physiology, your elective courses. And then the second year is specifically the surgical tech program. So from January all the way to December, you're in school to learn the skills specifically for surgical tech. So basically the first 2 months of the program, you're learning the basics, which is how to gown and glove properly. You're learning the name of the instruments and all the other equipment that you're going to need. You're learning sterile technique, which is basically the role of a scrub. We have to maintain sterility, which requires a sterile technique. So after those 2 months, you start an internship. You go to different hospitals or outpatient surgery centers where you can actually continue to learn those skills and to start learning surgery procedures. You can be a surgical tech without being certified, but nowadays a lot of hospitals are requiring you to be certified, because when you become certified, you have to take a test and you have to pass it with a certain passing score in order to be nationally recognized as a surgical tech. So when you are nationally recognized, that means that you can go to any hospital in the state and they know that you are capable of scrubbing in on those procedures.
Mm. And is the certification, do you have to pay for it, or that's something that you have to take for free?
Yes, you do have to pay for it. I think it's about $300 to $400, but I think that when you're in the program, they provide you a discount as a student. I'm not 100% sure on that. That's a question that you would have to ask the director of the surgical tech department. But yeah, I think it's about $300 to $400.
Okay,
And
awesome.
the one thing about certification is once you become certified, I believe it's every 2 years now. Of course, the policies have changed. When I first graduated, you had to get certified or recertified every 4 years, but I think they recently changed it to every 2 years. So once again, speak to the director of the surgical tech department to get those specific details.
Okay. So after you get your degree and you get your certification, so what option do you have when you go out on the field?
You have several different options. You know, your basic option is to be a surgical tech until the day you retire. You also have the option of becoming a traveling surgical tech. And basically, it's a surgical tech with a few years of experience who goes to different hospitals and works there under a contract. Usually, the contract is about 13 weeks. And you work with that hospital because they're low on staff. They need somebody to get in there and to do procedures immediately. They don't have time to train them or anything. And of course, with that higher level of the expectation comes a higher pay rate. So usually as a traveler, you make about twice as much as a regular certified surgical tech. And usually it's that way because you do not work directly with the hospital. You work with a third party company who works with hospitals to get contracts for your 13-week assignments. And usually you get paid twice as much. Is they also include money for your housing, your food, your gas. So basically they're giving you an hourly rate as well as giving you money to live. So that's the difference. Your third option is to become a first assist. And usually scrub techs will go on to become a first assist because all you have to do is go to a year-long program and it basically teaches you how to suture, how to use laparoscopic instruments. It basically teaches you another level of assisting the surgeon where you are more of their assistant than you are a scrub tech. Let's see, and they of course will pay you differently because it's a higher level of education, it's a higher level of expectation, so there's a higher level of salary. You can either work directly with the hospital as a first assist, or you can work directly with the surgeon as a first assist. And of course, the surgeon will be the one signing your paycheck versus a hospital. And of course, you can go back to school to become a nurse or a PA. I mean, there's several different options you can take as a scrub tech. Scrub tech is one of those jobs that gets you in the door, but there are plenty of opportunities to advance. Yes, they offer benefits, your health insurance, your life insurance, your 401k or 403b. It just depends. When you work for a hospital, you know, you get your typical hospital benefits. But if you work as a traveler, it's a little bit different. Your benefits are available, but they're only available as long as you have a contract. So you have a 13-week contract, the last day of your contract, your benefits end. So if you don't have another contract lined up immediately after that one, you will not get health benefits until you start a new contract. And of course, as a first assist, if you work with the hospital, it's just like a scrub tech. Whatever benefits the hospital provide, that's what you have. But if you work directly with the surgeon and the surgeon has his own surgery center, then you would have to see the benefits that the surgeon offers for his employees. So that's another thing to look into. I did have the opportunity to travel. I traveled for a year. It was one of the best experiences as a scrub tech, because like I stated earlier, I was led into scrubbing. I didn't choose it. So there was a lack of confidence within myself because it wasn't something that I had decided I was going to do. And the beauty of traveling is they don't train you. So basically, you have your 2 days of orientation. They'll show you around the surgery area your third day, and then the fourth day, you're in surgery. No assistant, no preceptor, no trainer. It's just you and your skills. And because of that, it made me build a level of courage that I did not have. It made me build a level of confidence that I did not have. And the fact that I could do those surgeries and I would be kicking myself in those procedures, but when it was over, the surgeon's like, oh man, I'm so glad I had you with me. And, can you always work with me whenever I come? That lets you know that you're doing something good, because a surgeon is not going to ask for you if you are not doing your job. So yeah, I would say if you have the opportunity to travel, do it, because it will look great on your resume, but it will make or break you. You will really know what you're worth when you travel. You can go to a different state. You just have to be within the United States. You can't go to Haiti or Jamaica or anywhere else and scrub. It has to be within the 50 states.
Okay. So how does this major affect your personal life?
Oh man, I would say first and foremost, being a surgical tech, it has made me become very OCD. When you are in procedures and you are responsible for all these instruments and all this supplies, that has to be counted. You have to count everything before the procedure, you have to count everything during the procedure, and you have to count everything at the end of the procedure. So in order to make sure you have everything you need, you have to be very organized. And that's one thing that has bled over in my personal life, is I'm very organized. And if something's out of place, it drives me crazy.
That's good. So being organized is really important in life sometimes, or most of the time. So I'm
And I'm
glad
also
there was
a
a
clean
difference,
freak.
right? Glad it was. So from everything that you just told us, so do you have any regret for being a surgical tech?
No, I don't have any regret. I actually love what I do. And that's one of the benefits of being led by God. He's not going to lead you into something that's not for you, or something that He has not given you the skills or the ability to do. So, of course, naturally, I love it. I enjoy it. Surgery is something that I see myself doing for the rest of my career, honestly, even if I advance. A certain part of that is going to have to require surgery. I don't see myself not doing it now. I mean, it just wouldn't make sense.
Okay, that's good. That's good. And about school, is like everything that you learn in school, is that what you do in real life, or when you go in the field, you see something different than what you learn in school?
But yes, everything that you learn will be applied in real life because once again, technical schools cut out all those extra classes that universities have. Technical schools are designed to get you prepared to go right out into the work field. So everything that they teach you is everything that you'll need. It's basically your starting point, just like any job. When you go to school, you get the basics. But once you get into the actual career field, into that mode, that's when you really hone your skills. And that's when you really learn more about what you do as a scrub tech.
That's nice. And our final question for the day. So, what advice will you tell someone who is interesting of thinking about becoming a certified surgeon?
The first thing I would say is surgical tech is not one of those jobs where you can fake it till you make it. It's one of those jobs where we can tell within seconds if you know what you're doing and what you're not doing. And the difference is you need to, you yourself need to know what you can and cannot do because somebody's life is on the line. Somebody is dependent on you to know what you're doing for them to be able to survive because patients come to us to get fixed or to prolong their life. And if you don't know what you're doing and you don't say anything, you're not helping. You're not prolonging their life. You're actually putting their life in more harm's way than what it already is. My second thing is if you don't have thick skin, don't do it. Um, Surgery is one of those intense jobs. It can be going smoothly 1 second and then it can hit the fan the next second. And you will have surgeons who are frustrated. They may yell at you, they may cuss at you, they may throw something at you, they may kick you out of the room. You have to be prepared for that. You have to know that it's not personal. This is business. You are right there with them. You are their personal punching bag at times, and you have to know how to stand up for yourself. You have to know how to maintain your professionalism and draw that line of respect versus disrespect. So it's not for the faint of heart. That's for sure. I think the third thing I would say is if you don't have a passion for it, don't do it. It will show in everything that you do. The patients will feel it, the surgeons will see it, the nurses will see it, everybody in that room will see it and feel it. And you do not make that surgery any better. If anything, you make it worse. We have to be focused. We have to speak up for the patient. If you see somebody in that OR that's not doing something right, you need to speak up and say something. So if you don't have the courage, you don't need to be in the field because we are the patient's advocate and we should be able to speak up to the surgeon. Surgeons make mistakes. Surgeons don't know it all. They're humans. They're doing something, you say something. And you should be able to check your own self. If you know that you're breaking sterility, you need to not be afraid of, oh man, they know that I'm gonna break sterility, so I'm not gonna say anything. No, you say something. You fix the problem. And if you can't do a procedure, then you need to let them know, hey, don't know how to do this. It's been a while. So either they can get somebody in there who knows what they're doing, or somebody can walk you through it. Don't pride, no place in surgery. There's no place for pride in surgery. You have to be humble, willing to admit your mistakes, be willing to correct them, or care, don't do it.
That's good. So hopefully everybody enjoyed the advice. Because for me, blood is not for me. So I know it's not for me. So I'm not gonna go for it. But anybody that can, deal with blood and think this major or this career is for you, you know, hopefully all the answer that she gave us today, you'll be able to put in practice. And if you have more questions, just like I said before, just leave your question below in the comment chat section, and then we'll do our best to answer the question to you. So thank you again. Thank you, Miss Shalisa, for being there with us. And hopefully it's not gonna be the last time that we're gonna see you. And everybody, thank you and have a blessed. God bless you.